welcome back to my YouTube channel. Today we're talking about the best non-hormonal options for treating vasomotor symptoms and other debilitating menopause issues if you cannot or choose not to take hormone therapy. If you're interested, stick around. So last week I did a whole video here on how to start on hormone replacement therapy. In that video, I went over some of the red lights for hormone therapy. That's another way to say clear contraindications to using hormone therapy, an instance where the risks would outweigh the benefits or are potentially more likely. So in this video, I want to start with thinking about if you do have one of those red lights and you do have symptoms of menopause, what can you do to alleviate your symptoms? If you don't know me, I'm Dr. Heather Hirsch. I'm a board certified internist. I'm the lead clinician at Midi Health, the first and best virtual platform for midlife women's health. We see patients in 10 states and many more to come. The link is in the description below. But without further ado, let's start by going by symptoms. I'm going to talk about hot flashes, then genitourinary syndrome of menopause, and then sexual function. This video is also great if you are already on hormone therapy actually, and you don't necessarily want to change your dose, or you're already at the max dose, so that you can see what are the non-hormonal options that you might want to add to your regimen to help you alleviate your symptoms. When it comes to hot flashes, the first thing I want to say is there is a new novel non-hormonal medication that is hopefully coming to market in 2023. This medication briefly is called Fezolineant, and I did a whole video here on this medication back in 2022 as I was excited for it to come to market. In fact, this medication is going to be a game changer because of its mechanism of action. This medication is going to work in the hypothalamus, a region of the brain, to help reduce your core body temperature. And the reason this is so exciting is because it's particularly well targeted to treating vasomotor symptoms, and because it's non-hormonal, can likely be used in patients whom cannot use hormone therapy, such as our breast cancer patients and breast cancer survivors who tend to have severe symptoms because of the fact that they are put into an earlier menopause, either by surgery or chemotherapy. Now, this medication at the time of this taping, which is early 2023, is not out yet, but I do hope it will be out soon, and check out that video if you want to learn more. Other non-hormonal medication that is FDA approved to treat vasomotor symptoms is called Brisdel. Brisdel 7.5 milligrams is actually an ultra low dose of an SSRI you may have heard of before called Paxil, or its brand name is paroxetine. Now, paroxetine or Paxil does come in 10 milligram tablet, but Brisdel specifically is an even lower dose. It's 7.5 milligrams of paroxetine, yet because it is branded and specifically that dose, 7.5 milligrams, it is a separate medication, tends to be a little bit more costly than the paroxetine. So oftentimes I just prescribe paroxetine 10 milligrams, but Brisdel 7.5 milligrams is the one and only non-hormonal FDA approved medication currently on the market in February 2023 to treat vasomotor symptoms. Because these medications release a little bit of serotonin in the brain or keep serotonin in the brain longer, we have found that that mitigates either the severity or the frequency of the vasomotor symptoms. And at the lower doses, it actually works much better than higher doses of SSRIs. Another non-hormonal medication that can be really helpful is gabapentin, also known as Neurontin. I would use this in really low doses because it can make you sleepy. And finally, oxybutynin, which is a medication commonly used for overactive bladder. It works as an anticholinergic, is another option, but can have a lot of side effects, including dry mouth and constipation, which, let's be honest, nobody really wants. Now on to vaginal dryness. Now, if you have vaginal dryness and you cannot or you choose not to use an estrogen-based product, what are your options? Well, the first one that you should consider is perastrone. Its generic name is Interosa. Now, perastrone is FDA approved DHEA. That means it's a precursor to both androgens, i.e. testosterone, and estrogens. It works intracellularly to convert into estrogens and androgens, but does not cause systemic levels of estrogen and testosterone. This could be a really good option because genitourinary syndrome of menopause is a very significant and severe issue that can compromise not just your sexual health, but also your urogenitary and bladder health for the rest of your decades of life. So progesterone would be a really good option to consider. Another medication in this classification for women who can't take hormone therapy is ospemifene or Ospina. This medication is a SERM. It means it acts like estrogen in some tissue and unlike estrogen in other tissues. And it acts like estrogen at the level of the bladder, the urethra, the vagina, and the clitoris. It's a once daily oral medication, and it is a really nice option. This is also a good time in the video to let you know that this is not direct medical advice. Most of these are prescription medications, so you are going to have to talk to a qualified doctor who can help you make these decisions and ultimately get you these prescriptions. There are also some great moisturizers that I would recommend using on a near daily basis because they're not going to be the same in terms of estrogen and reversing the atrophy, but they will help to plumpen up that epithelial layer so it doesn't tear so easily. So there's many good moisturizers. Sweet Spot Labs has a great rescue balm that I talked about in this video here. I also like Femme Pharma and many other over-the-counter moisturizers can all be used. Just check to see that their main ingredient is something like hyaluronic acid plus or minus some vitamin E. Now, the next big category is sexual health and sexual function. Hormone therapy definitely can help libido, and sometimes it's just the estrogen, sometimes it's just the fact that you're sleeping more and your symptoms are resolved, and sometimes we do use testosterone. I have a video on testosterone here if you're interested, because that is something that could be considered for someone who has red lights for an estrogen hormone-based therapy regimen, but that is also a little bit of a deeper conversation. There are 2 FDA-approved non-hormonal options for low libido, so let's talk about those. The first medication is called Addy or flibanserin is its brand name. This is a really great medication that is FDA-approved to treat hypoactive sexual desire disorder, which is low libido that is bothersome and frustrating to the patient. Now, this is a once daily oral medication, and it is a dopamine agonist, which means it releases a little bit of dopamine in your brain. And dopamine is a great reward hormone for doing things like sex and other things that are fun, like loud music, dancing on tabletops, eating chocolate. You get it. But Addy is a really nice option here. One thing to note is that it is FDA approved in premenopausal women, but me and many NAMS experts really do use this a lot in women who are postmenopausal because it's just that was the group that the medication was FDA approved and studied in, premenopausal women, but there are no major physiologic differences here between someone who still has a period and someone who doesn't when it comes to treating HSDD with this medication, flibanserin. And finally, there's a medication called Vyleesi or bremelanotide, and this is an as-needed injectable. I'm looking around my desk because I usually have a placebo cartridge on my desk, but this is an as-needed injectable, and it's great because it can be used before date night. So for women who don't want to use a medication every day, or for women who are on multiple medications and don't want to add to their medication burden, this can be a great way to boost your libido on an as-needed basis. I love for women to know that there are many tools in the toolbox. There may not be 50 or even 5, but there are a handful. And in the right combination and with some trial and error, it really is very possible that you can find relief for a lot of your symptoms that are specifically related to low estrogen state and specifically related to menopause, even if you can't or choose not to use hormone therapy. So I want you to know that there is absolutely hope for you. Do let me know what you're most interested in learning about. If you scour some of my many YouTube videos, I do have videos specifically on some of these medications, so I have longer format on just those medications talked about in this video. I hope you guys found this helpful, and I really appreciate you subscribing and watching my videos and sharing them to your socials and sending them to your friends. I love you guys so much, and I'll see you next week for a brand new video. Bye, everyone.